Well, aloha. It's great to see all of you here on this Thursday. I'm Ryan Kalesuchi, joined by Yunji Denise. We want to thank you for tuning in to the COVID-19 care conversation here on the platforms of the Honolulu Star Advertiser. It is turning out to be a busy Thursday. A lot of news coming in here, but we will get to some of those top headlines. Of course, this is a conversation that is brought to you by the Hawaii Executive Collaborative and Hawaii Pacific Health as we sort of navigate through these somewhat unprecedented times together, bringing you some of the information and connecting you with local leaders who are really making an impact in our community surrounding COVID-19 and the way the state is responding. And today we have yet another special guest, Yanji.
That's right. We have Mufi Hannemann, the CEO and president of the Hawaii Tourism and Lodging Association. So much of the conversation that we've had over these last many weeks has been about the economy. We can't have an economy if we don't have tourism, and we can't have tourism without hotel and lodging. So how is that industry doing? How many hotels have shut down? How many hotels will be able to come back with kamaaina travel? And then going forward, what is the industry's position on how to safely open tourism, not only for the residents of this state, but also for the workers and for the visitors themselves. So we have a lot to talk about with Mufi this morning. We're so excited that he's here. If you have a question for him, please write it in the comments and we will get to as many as possible.
That's right. And of course, we'd like to always start off by giving you an update on some of the new cases. Again, another single digit day here in the state of Hawaii, just one new case. And the Department of Health actually removed a previously recorded case from Maui. They retested it. It came back negative. So the new total of statewide cases is 653 positive cases since the outbreak began. Again, no new deaths for over a month now. It has been unchanged since May 3rd. And more than 95% of those infected have recovered. We talked about some of the headlines that were making news today. And one of the stories that is featured in the Honolulu Star Advertiser directly ties into some of the things that we'll be talking to Mufi Hannemann about. And it's really about the incoming passengers and visitors to Hawaii. The Lieutenant Governor yesterday pushing for a new idea, a new concept of random testing.
Yeah, the idea that he has is that they would offer voluntary, but hopefully people would comply. 1 in every 20 passengers incoming to the state of Hawaii or getting on and off a plane would be asked to do a nasal swab test for COVID, so they could kind of get an idea of how much of the virus is circulating in the community. It would just be one more measure that they could quickly, test, because we know that so many folks who do carry the virus are asymptomatic. And so we'd love to get Mufi Hannemann's thoughts on that. We welcome Mufi Hannemann, President and CEO of the Hawaii Tourism and Lodging Association. Thank you so much for being here this morning. We saw a quote from you in the paper this morning saying that you think that this is a good idea.
Well, thank you again for having me on your show here. I think any opportunity we have to get out what the industry is doing so that we can reopen safely is very commendable. So thank you for this opportunity. I think in a perfect world, obviously, we would like to have mandatory testing across the board. But it's also very difficult to do according to the airlines, according to the airports, all of those who are on the front lines of implementing such a plan. And then most importantly, for government to feel confident that they can do something without requiring mandatory testing. So what I like about this, at least it's testing of some sort. It's not foolproof, if you will. It's not going to be done to every passenger that comes in. But, if you have someone like Lieutenant Governor Josh Green, who's really been at the forefront as an elected official, sort of providing guidance and advice along the way, if the State Department of Health, through Dr. Bruce Anderson, Dr. Sarah Park, are saying this is acceptable, then I'm deferring, as we always have, to the health experts. Let them say to us that this is something that can be done, that can be implemented. So my position is basically that if it passes muster with them, and they're saying that this is a key component for us to reopen, then what we have to do from the hotel side and every visitor industry stakeholder across the board, the attractions, retail, restaurants, have to make sure that they have standards in place. So when that person leaves the airport, he's a healthy traveler by all accounts, and that we will receive them as they do business here, as they stay here, in a form that we can continue to maintain the fact that they will be in a healthy environment. So our standards was written, we put it together from HLTA, I authored it, with all the hotel brands that were involved. We have hotels that are members of labor unions. We have others that are non-union. We passed it on to all of them. It's minimum guidelines that was written, taking into account what national organizations are saying, whether it be the Restaurant Association, whether it be the Hotel Association. But most importantly, it was an eye towards making sure, the workers first and foremost are going to be protected and they feel safe to come back to work. Number two, obviously, for those that visit us, be it kamaaina or travelers, that they will be entering a health and safe environment. However, as it's always been proven, if someone should be ill while they're here for whatever reason, we have a plan also that will go forward to make sure that we put that person in isolation, that we have them tested, and that we basically provide accommodations and then get them to a hospital if need be, when the Department of Health also gives their okay in that regard. So that's why I think it was really important. I say to our members that I want to go to the Department of Health. And of course they say, well, there's so many other things to do. I said, ours is very important. I want their approval. I want their stamp of approval, because then we can go to the mayors and say it's been vetted and also approved by the State Department of Health. And because the counties do not have a Department of Health. I know that very well. I haven't been a former mayor. But I think it's all good, because once again, we want to restore trust. We want to have confidence. And let's keep in mind, people are not automatically going to come to Hawaii when we open up. There's a great amount of anxiety out there, people not wanting to travel. In fact, I saw a survey that said 30% of Americans want to wait till 2021 before they travel. So, but I think that's all good, because we're not going to open ready to go all at once. There are ramp-up costs that have to be factored in, making sure that you train the employees of the hotel to recognize there's a new normal. So it won't be like overnight. And they may also open up very gradually, because you won't have the occupancy that you've seen in the past. The airlines have said only 60% of their seats are going to be available. So that's 40% less. And the hotels will probably also adjust accordingly. We have about 111 hotels that are shut down right now, and probably nearly less than 100 that are operating. So for the major brands to open up their resorts, it's going to take a while for them to do that, because they have incurred significant losses. So we have said to government, our leaders, please give us a schedule. Please give us deadlines. So if you say inter-island travel will open up on a specific date, we also need to know when you expect to give the approval for domestic or possibly bubble travel internationally, so that we can plan accordingly. I'm all for opening up inter-island travel. I think that's the way to go, making sure that families that haven't been connected, local families, have the first chance to travel in a safe way. But let's face it, that's not going to provide much of an impetus or motivation for all the hotels to open up, unless they know that shortly thereafter, or 3 weeks thereafter, 4 weeks, whatever it is, that inter-island travel or, transpac travel or international travel can take place.
I want to ask you about those hotels specifically. You mentioned some of them continue to remain closed. Will some of these hotels potentially be opening up when the neighbor island travel begins? Could you see some of them being able to operate just based on kamaaina travel, or will it take the opening of the state to other guests in order for them to have the numbers to be able to financially be able to open up?
They've been losing millions a day by not being able to open up. So I think it would not be a really realistic scenario for them to open up once inter-island travel begins. So I really believe the best candidates are those that are currently operating. Perhaps some will be ready to come in because they're ready to go. They're not having as significant losses as some of the major brands are. So that's why I said earlier, if government can give us a schedule, say on this date, this is going to happen. On this date, we'll be able to reopen for you. Then I could see them stepping up and maybe open gradually and taking advantage of neighbor islands to do what I've always said is It's the preseason game. Preseason game is when you kind of get ready for the full season. And so when the season begins, you know what, you're ready, you're ship shape, you know exactly at that point in time what demand would look like. Everything is based on future bookings and so forth. So it kind of be a soft opening as I see it. And I want to be able to say that unequivocally because there are those that feel that 10 million visitors will start coming back. It will not happen. I can tell you that it's just not a realistic scenario that all of them are going to come back at once. Besides, I've been advocating for the longest time throughout my public service career, and now in this private industry position, and Chris Tatum, the head of HTA, that we want responsible tourism. We want sustainable tourism. We want tourism that local people can feel good about, that they can benefit from. And we all know that there are challenges to basically make sure that that occurs. So we're beginning right now in dialoguing with those that have good ideas on how to do responsible tourism. And we recognize that that's a very important part of reopening. Not only do we do it in a safe manner, but also assure the public that this is not going to be a rapid rush to try to get many people here as possible. It ain't going to happen because we want to make sure that we do as much as we can to prevent that second wave that is a possible candidate again, especially in the fall if you reopen.
You know, government has not given us what you're asking for. We don't have a date for when that will reopen. And there's so much economic uncertainty that comes with not knowing those plans. Given that landscape, how much longer can these hotels, we know that whether they're open or closed right now, the vast majority of them are losing money. I can't think of any that are actually really making it. You know, how much longer can they sustain this? Do you expect some major hotels to pull out of Hawaii, to shut down? What does the landscape look like?
Well, we were really alarmed when one of the economists said that it'd probably be, for all practical purposes, that we reopen in September. I can guarantee you that some will fold if they have to wait that long because they're losing tons of money. And keep in this perspective, even though a person may not be working and is receiving, assistance from government as they are unemployed, we are very committed to maintain their health benefits. That's very important. We've been carrying that for 3 months as they've been unemployed. So on July 1 has always been the magic date that we said we got to reopen because that's another cost. For some of them, they're just spending $1 million to $1.5 million just to keep the health benefits. And that's very important because we don't want to bring people back to work if they don't have health insurance. So that's a deadline that we've basically communicated that to our leaders, that the sooner that we can start opening, that we can plan, we can forecast. I know the unions, both IOW and Local 5, have stepped up to the plate to also cover some of the things that they need to do as their member associates are out of work. So, and all that is really done without government assistance in that regard. They get the unemployment benefits from government. So to answer your question specifically, I don't know when that breaking point is going to be, but I do know if we don't open up in July, there's going to be great difficulty in trying to open up and try to cover all your expenses. The other thing is that property taxes of the hotels and resorts are due in August. So we've written to the mayors and said, we'd like a waiver for a period of time to put people back to work. Now, if the counties are not able to do that, then that's going to be another roadblock to try to get people back to work as soon as we would like to. So there's a lot of challenges involved here. On a micro level, it's also happening with restaurants, with attractions. It's a ripple effect across the board. We cannot continue to go down this path, especially if you have a quarantine policy where people are basically healthy. You shouldn't be quarantining healthy people. And so therefore, we'd like that quarantine policy to be lifted when we reopen, because if you still have that in place, that's a sign out there that Hawaii is still not a safe and healthy place to go. So we're ready to go. We have standards in place. Ours were approved by the Department of Health. We know all the major visitor industry stakeholders have done likewise. We know that the airlines have a policy now and they've made it known of how people can travel to Hawaii and how they would depart from Hawaii. We know the airports are there. They have thermal scanners that they're invested in. That will be at every gate as you arrive. You're going to be tested again in terms of a screen to see what your temperature is. If it's over 100.4 degrees, you will not be allowed to disembark. You have to be isolated. And, so it's all these things that are involved in this. We understand the meticulous pace that our government leaders have gone, but it's sort of like here we had at one time the lowest unemployment rate in the country at 2%. And now we have, we're like number 2 or number 3 in the highest unemployment rate in the country. So there's got to be a balance there. If people are really out of work, then how do you find that middle path to be able to bring them back? So I commend Lieutenant Governor Green, who has been an ardent supporter of mandatory testing, to kind of see a way that we can still do that, albeit it's not every person, but because the way that you fill out the forms, because of the temperature checks that are going to be taken on both sides, intensive screening, all the new normal ways of being part of whether people boarding the airplane with a mask on, all those things, social distancing, as I said earlier, not being able to fill your airlines to full capacity, and coming here, recognizing that we also have to set aside some rooms for those that may be sick while they're here, because we should isolate them until they get tested and find out whether they in fact have been infected. All those things require time. All those things require planning. All those things require a good budget put in place and take into account all the ongoing expenses that you've been paying, and now the additional expenses that come in, especially with the property taxes.
I want to ask you, bring in a question that a viewer asked about voluntary swab tests available maybe at the hotels. So Kristen's asking, can hotels have voluntary swab tests available similar to what is proposed every 20 airline passengers as an optional tool to that company? Do you foresee something like that happening, where any sort of testing or any sort of swab test potentially is done at the hotels itself? Could you see something like that happening?
Well, what we've done to explain that excellent question is that we have set out in our standards, and I invite you to go to our website to see what we have agreed to as hotels across the board. There's nothing to prevent, because these are minimum guidelines that, as I said, include things that CDC wants, OSHA wants from a federal perspective, and also what our local government is asking for. But this basically are our minimum guidelines that we put in place that covers all these areas and suggested ways in which to carry that forth. If brands or hotels want to go beyond that and incorporate what you're saying, they're perfectly free to do so, because that is what is required to be a brand member of that particular hotel. Or if your hotel is being asked by the union to do more, then you should do it with those hotels that are under your kuleana. So, and that shouldn't apply to another hotel that may be under another union responsibility, because as I said, there are 2 major unions. And certainly if you're non-union, that shouldn't prevent that union from not having to adhere to a higher standard that you want to put into place. So that could very possibly happen if a brand is requiring that. It could very possibly happen when the unions negotiate with those hotels that they have responsibility for, I should say, that their members are part of. That could happen. So that's the answer.
I'm interested in the safety protocols that individual hotels that you sort of set forward as an organization. What will a traveler experience be like when they start to go back to hotels? I would imagine that the mini bar is gone, and there's probably not a phone in the room, and a lot of those common touch items are gone. What is the actual traveler experience? Because you want people to still enjoy the experience and have luxury when they come here. The average daily room rate before the pandemic, and I don't know what it is now, but I believe it was over $250 a night here on Oahu. So it's not cheap to stay here. How do we make people feel welcome, and that they're, do you make them wear a mask in the hallway? How are you guys figuring all of that out?
Well, all the aspects and protocols that have been communicated now as we have worked our way through this whole pandemic situation, where very few incidences are being reported each and every day is the result of that game plan that was laid out. Wash your hands, make sure that you do it constantly. So certainly wearing masks when you go out in the public, and of course the physical distancing. So all of those components will be in place. I think the difference now, when you come to the resorts, you will find a much more intensive effort to assure people that are going to stay there that here are the rules. So they'll be given that as soon as they come into the hotel. We have said to them too to make it very clear, communicate where these areas are going to be strictly adhered to. Another example I give you is the traditional giving of the lei. In the past, that's always been welcome to Hawaii. You get it at the airport, you get it at the hotel. Well, that's going to have to be done very differently because of the physical distancing requirements we expect of everyone. So it may be given on basically on a table where you have to put it on yourself, or maybe someone comes to you, maintains that physical distancing, and lays out a tray where you can get your lei. So we're leaving it to the hotels to do that. We said at all those frequently, basically high frequency, I should say, where there's a lot of usage, whether it be you get your water, your bottled water, not your bottle, you get your water in one of those machines that become very, very popular, as we know now. Put your cup there, your water comes in. Maybe that has to be eliminated, perhaps, or constant going back with a cloth, with the proper disinfectant to make sure that that gets done. Social distancing is going to be a part of every hotel. I can tell you that, and even in the restaurants that they operate. It said, like, if you have a 50 person capacity, you'd be lucky if they say it's 25. It could be less than that. That will be strictly adhered to. So it'll be a very different kind of experience. But we'll say that, we want you to leave here healthy. And we want everyone to know that by the communication that's going to take place to ensure that we do that. Rooms are going to be cleaned much more frequently. The carpet is going to be basically disinfected constantly, because we're also going to adhere to what the CDC says in terms of the disinfectants that should be utilized. Also in terms of how many times common areas are basically people are going to go there, employees are going to go there and wipe it down. And also the interaction with the guests is going to be done very carefully, especially if someone displays some symptoms. We're hoping that we're recommending minimal interaction, if any, with them, and it should be done in a way that we guarantee the safety of our workers. So it's going to be a very different kind of experience. We recognize that it has to be done, but hotels around the world should be doing the same, not just like Hawaii. So when they come here and they've gone to other places, maybe it's not going to be such a rude awakening that Hawaii is being so stringent and asking you to do certain things that you're not doing elsewhere.
Yeah, great. Go ahead.
I do want to ask, though, all of the things that you're laid out, they sound great. They also sound pretty expensive. If you have a restaurant that can operate only at 50% capacity, if that, and has to be constantly clean, that requires more materials, more staff, what have you. Are the hotels going to be able to make money and able to survive? Are we going to see, instead of a $250 average room rate, is it going to be $500? How are they going to be able to afford to actually run a business? Because at the end of the day, they do have to make a profit.
That's an excellent observation, Yuji. We still need to do more education of our government officials and the public that, for hotels to open, for restaurants to open, for small businesses to open, it's a huge cost that's involved. And if we're going to adhere to stricter standards, government's not going to pay for that. We have to pay for that. We have to absorb that in our financial plan and going forward. So that's why, we've been insisting, let us know when the deadlines are going to be lifted so that we can plan accordingly. Maybe thinking of, I got to bring back 200 employees because this is what I know today what's going to cost. Then they might say, oh my goodness, I got to change the forecast. Now I got to go down to 100 because I can't afford it. Because they know that the number one feature of a hotel reopening is the health and safety standards. And we have that in place. They have to adhere to that. From what we are recommending, the Department of Health has seen that. And part of this, too, was convincing the Department of Health that we're good to go. And, they continue to have questions, and their questions all had to deal with contact tracing. They wanted to know that if a person at a particular hotel is basically COVID or something else that might be very harmful to the public, who do they contact? I gave them 3 points of contact. You got to contact whoever that person is that's in charge, and every hotel will have that, of the whole operation in terms of when COVID travelers or COVID local folks are basically diagnosed as such. Who can they call? They can call that person who's in charge of that safety coordination at the hotel. They'll have a number for the general manager of that hotel. The third number they're going to have is someone from the chapter of the Hawaii Lodging and Tourism Association, who are statewide on that island, that they can call. So 3 numbers that they can call. They've all been instructed, you got to pick up the call and the like. I even went so far as saying this. One of the ideas I want to explore that costs money, because government is not going to pay for it, is the idea of having a resident epidemiologist expert that they can call on. So this could be someone right here, not in the State Department of Health. Queens has a specialist. All the other hospitals have a specialist. Maybe if some of them can put a cadre of specialists involved in that field, then what we would do is we'd like to retain them perhaps. And so that they would be the person that we would review constantly, our standards, what's going on, so forth. And I know when I bring that up, and I have already, some will be very receptive to it. Others might go, oh my goodness, in a perfect world, in your words, but we'd love to do it. But how do we pay for this? So these are all the things that I'm going extra overtime to ensure that we're doing all we can. But keeping in mind is also the factor of the longer we delay, the more we're going to pay. And in this case here, financially, and if we can't come back up, then we're going to be in a world of pain. Before the pandemic, I think we had 1.5 million visitors that had come to Hawaii. We'll be lucky to get up to 1 million before the end of the year. So occupancy could be as low as 20%. It could be as high as 30%. I don't see it going much beyond that. Some have said 50%. Well, that's a goal. That's a goal that the economists are putting forward to us. It's going to be very challenging given all the financial limitations in reopening.
Well, Mufi Hannemann from the HLTA, thank you so much for your time. Unfortunately, our time has come to an end with you, but we really appreciate you taking the time here out of your schedule to join us and provide those insights. I think a lot of people want, of course, the state to open, but there are a lot of planning that's happening behind the scenes, and we appreciate the update and you taking time to join us again today.
Well, thank you for the opportunity to be here, and I just want everybody to know we're all about responsible tourism. We're all about sustainable tourism. So please don't get alarmed by the fact that once we reopen, people are going to come back to Hawaii. It ain't going to happen because we're going to put a plan in place to make sure it's quality travelers that come here, not just quantity. It's quality over quantity.
Okay, thank you so much for being here this morning. Great to hear those updates from you. Interesting about the plans that he has talked about putting in place. It does sound, though, Ryan, like that it's going to be a lot of costs, and it's not clear if we will have the visitor population. And you hear him there saying we need a date, and I think a lot of folks feel that way. At every step of this pandemic, since the shutdown began on March 25th here in the state of Hawaii, at every turn, people are asking for dates. When can I go out to a restaurant? When can I get my hair cut? When can I travel to the neighbor islands? But for business, this is so vital because, as he said, they need to plan for their workers. They need to invest in new protocols. It is really challenging. So good to hear from him this morning. Yeah,
an interesting point about just, while a lot of these hotels are closed, they are still paying for some of these health benefits and these other costs that often go unnoticed. And so these hotels are continuing to not only lose money, but they're also having to pay for some of these benefits as well in hopes of getting these workers back and also making sure that they're safe and it's safe for them to return when they come back. Of course, yeah, you're right with the date. Governor Ige has said on this broadcast that he's weary of giving dates because things are so fluid that oftentimes we can have a benchmark of the target date we're shooting towards. But if something happens, a lot of times that changes. So Great to hear an update from him, and we'll continue to keep you posted with any updates as we hear about the reopening of Hawaii and, of course, the visitor industry.
Yeah, and we love to read your comments. Ingrid, I see you. Choosing a date would be irresponsible. We have to act based on health and science. You're right. I mean, it is hard. And Ryan makes a good point that the situation is so fluid. If suddenly we have a big cluster, then the date moves, and then people have planned in one way and now they have to shift to another. So you're right. I mean, there's nothing hard and fast with this. All we know is that we practice social distancing, keep our masks on, wash our hands, and really hope for the best, because this is a really tough situation. And you're right. We feel for everyone who is going through this. On that point, today there is going to be 2 final food distributions. City and County of Honolulu has announced. We know that they were doing every Wednesday and Friday in May. Well, it's today at Aloha Stadium, and on June 9th at Aloha Stadium, they are going to be doing 2 more of those major food distributions. So, if you're someone out there who happens to work in the visitor industry and has lost your job, or, in any industry and you've lost your job, that those resources are available again today and on June 9th at Aloha Stadium.
That's right. And we've seen those long lines continue. And I think it is a service that a lot of people will miss, because there are no doubt people that are still going to need those food services. But we also know of other independent organizations, nonprofits, churches that are also doing similar food drives. They're going to hope to help to carry this beyond and coordinate, so that there are going to be other opportunities for people to get food at various different sites and locations, not necessarily driven directly by the Hawaii Food Bank, but through these other conglomerate of these nonprofits that people can also go out and pick up food from as well. So we will continue to keep you posted on those as well as we hear about some of those drives. Of course, we like to end on a good note every time by highlighting our Hawaii hero. And again, this is a hero that we want to recognize for the work that they're doing in our community.
Yeah, this is RISE. They serve Oahu's homeless youth with temporary shelter, services, support, and especially during the pandemic, when a lot of youth have lost their jobs and can't go to school, they've lost access to their support system. RISE is a Hawaii Community Foundation Resilience Fund guarantee. So mahalo to them for all that they do. Also letting you know about this thing to lift your spirits today, this event. Makaha Sun's returning to the Hawaii Theater for a free concert. Of course, that is live stream. You can't head downtown, but you can enjoy the music. And they will be joined by Raiatea Helm, who has one of the most beautiful voices, I think, in our state. I just love to hear her sing. So we are so excited that the legendary Makaha Suns and Raiatea Helm will be streaming live on Facebook through the Hawaii Theater at 3 o'clock this afternoon. So if you happen to be home, turn on your computer and listen to a little bit of Hawaiian music to lift your spirits.
That's right. We want to, again, recognize all those who are doing great things in our community. Coming up tomorrow, we have another special guest. We have Peter Ingram from Hawaiian Airlines, who are going to be talking a little bit more about the changes that Hawaiian Airlines has made as Neighbor Island Tribal begins to open up again, some of the implementations of some of these restrictions that we've been hearing about, and how checking in and the overall airline experience is going to change for a lot of people. And so it'd be great to hear from him. Also get an update on Hawaiian Airlines and just the overall impact that this has had on them as a company. So we encourage you to come on back here at 10:30 tomorrow to hear more about Hawaiian Airlines and their efforts.
Thank you so much again for being here. We appreciate all of you. Make sure you watch that concert today at 3 to feel good about living here in Hawaii. Enjoy the beautiful day as much as you can, and we will see you right back here for Aloha Friday. We will be joining Peter Ingram, as Ryan said, and until then, have a great day.
Aloha.